Rajeev Gowda, I don't hold the objection valid. Yeah. A little bit of tamasha is also good.
So,
Okay. No. That is expunge. Double standard is expunge. That is aspersion to the on the chair.
Government, sir.
Sri Rajeev Gowda.
sure. Thank you, sir. So, as I rise to speak on the Mental Health Care Bill 2013, my mind goes back to a childhood memory. I was a young child and I saw a naked woman with young boys throwing stones at her. And I asked the person who was with me, what is going on? And that older boy who was with me said, she is a huchi, which means she is a mad woman. And that woman was running away. That was the kind of treatment that poor people with mental illness suffered in the Indian context, maybe still suffering in different parts. This bill is a humane bill. This bill is part of the UPA's efforts to empower people with rights, and in this case, it empowers those with mental illness with the rights, the right to dignity, the right to treatment, the right to autonomy, to make their own choices with regard to their treatment. So, for this, I want to congratulate Sri Ghulam Nabi Azad, our leader of the opposition now, who was the health minister who had the foresight to bring this bill in and to make India's legislation in consonance with the UN Convention on Rights of People with Disabilities. So, we are worried about the growth of infectious diseases. We are worried about the growth of non-transmittable diseases like diabetes and heart disease and things of that sort. But the other ticking time bomb in this country is mental illness. Today, we don't really have exact numbers on the nature and the extent of mental illnesses of different sorts. But fundamentally, there are numbers that are out there. One such number says that the mentally ill in India already constitute 6.5%, and that by 2020, just before, in the next 2 or 4 years, that percentage may go up all the way to 20% of Indians. We are living in a much more stressful world. We are living in a world where economic pressures are causing innumerable stresses on people, on families. We are living in a world where urbanization is changing people's milieu, seeing migration and the difficulties of adjusting to a new situation. We're seeing families change from being support systems to people being on their own. And even more importantly, sir, what we are seeing today is the rise of hate speech, where different communities and peoples are being targeted, such that people growing up in these communities will be wondering what have they done to incur this hate, to be the targets, and this will cause stress and mental illness on its own way. So, our Constitution talks about our desire to provide equality of opportunity. But equality of opportunity will not happen if a person does not have the capacity to fully utilize his or her potential. And the kinds of mental illnesses that we have talked about today, depression, anxiety, bipolar disorder, schizophrenia, all these are barriers to people being able to fulfill their own potential. So, there are many, many good things in this bill, and one of the most important ones is the fact that it decriminalizes suicide. Other speakers have also spoken about that. When a person attempts to take his or her own life, that person is crying for help. That person is not someone who should be treated as a criminal and thrown behind bars. We need to reach out and find a way to overcome the problems that have caused that kind of action. So in this context, the health minister is not here, but other ministers may please convey. There is an important role played by the media. And we need to urge the media to develop some kind of a code of conduct for itself. Every day in every newspaper, on the second or third page, you will find stories about people committing suicide. When other people who are vulnerable, who are wavering on how to cope with their own crises, when they see such stories, that can break them and cause them to indulge in a copycat act. So I urge the health minister to reach out to the media, and just like they cover communal clashes in a much more temperate manner, let them also find a way to not stress suicides in the way that you do currently, and create a signaling effect that will hurt numerous others. So, When we think about suicide, there is so much that can be done in terms of outreach, in terms of counseling, in terms of prevention. Sri Nadda is the chairman of the Nimhans Institution, president of the Nimhans Institution. I am the Rajya Sabha member on that institution, and we have spent time together talking about how much more the institution needs to do in terms of outreach, in terms of counseling. And this is something that needs to be done in the particular context of farmer suicides as well. We know that sometimes crops are failing. We know that people are under stress. If we reach out to the banks ahead of time, we may find out who is unable to pay. There are so many early warnings that we can catch, but we don't have the infrastructure, the personnel, the will to go out there and prevent problems from occurring in the first place. We must change that. So this bill asks for a lot of infrastructural investment. And that is something which, of course, makes us question whether this is a money bill or not. But the good thing about this infrastructure investment is that a lot of this infrastructure is not a separate mental hospital, but an integration of mental care facilities with general hospitals, which is a good thing, which removes the stigma associated with mental illness. So the biggest need, and many speakers before me have mentioned this, is community rehabilitation centers. These are not hospitals, but these are in-between homes which allow people to find a way to settle down as they move from treatment back into the community, back into the bosom of their family. We need many more of these sorts of institutions out there. But most importantly, when we talk about infrastructure, we need human resources. That is the crucial infrastructure. Our count of psychiatrists to the general population, 0.2 per 100,000. This is really, really inadequate, and that's at the doctor level. But what about at the mental health nurses level? What about training others to be more sensitive to mental health issues? Others have also already spoken about this, but you start with the assistant auxiliary nurse midwife in the village and sensitize her to how to deal with children who might have problems. We need tremendous curricular innovation. We need short programs, long programs, various training initiatives that will ensure that teachers in schools are sensitized to adolescents and their own problems, and that they can prevent them from being bullied, from breaking down, and mental illnesses cropping up and worsening the situation. So there is a tremendous amount of work, amount of curriculum, amount of training that needs to be done across domains to ensure that counseling becomes an integral part of every school, every college. We have to therefore reach out to the voluntary sector. There are numerous NGOs. Instead of going after NGOs, we should go after them with a request. Scale up your operations, do more in this sector, help the older people cope with mental illness. And whenever there are disasters, whenever there are crises, natural disasters, people are in deep trouble, and we need measures to ensure that they also get counseling and other kinds of support. During exam time, we need much more ramping up of suicide hotlines, other kinds of measures that will help teens cope with the pressures that we parents put on them. So there are many other good things in this bill, the advance directive. On the nominated representative, we have issue of how do families get integrated? Will somebody exploit the patient? These are all issues. Families themselves need tremendous counseling and support, because taking care of people with mental illness is very stressful. And for those who have to cope with a suicide, it is even much more devastating, and many are not able to do so. So there's one other issue about the kind of treatment directives that are mentioned in this bill versus the judgment of the doctors themselves. That is something that must be nuanced as we go forward. Finally, I want to say, this is the country that is the birthplace of spirituality. We have come up with numerous ways to talk about how to cope with the ups and downs of life. Instead of misusing our spiritual heritage for dividing people and religions, we should harness the best of that spiritual heritage of ours to give people that strength to cope with the ups and downs, with the challenges that life throws at us. When that happens, then this humane bill, this wonderful, positive, rights-oriented bill that was piloted initially by Sri Ghulam Nabi Azad, and now is the honor of Sri Nadda to take it forward to completion, that this is the sort of positive bill that will strengthen the mental health of all Indians and unleash our potential so that we can be a transformative people going forward. Thank you, sir.
So, Gerard Messi, Now I understood why you opposed it. Because this was piloted first by Sri Gulal Nabi Azad.
I didn't take objection at that time.
Exactly, okay. Then I stand corrected. Okay, now Hussain